When you go into the consultation, these are some medical terms that you may hear and you want to know what it means. Hematoma, it means blood getting accumulated under the skin after your surgery, whether it's face, whatever surgery you have, and causes expansion of the skin where the surgical area was, and it requires removal of dry blood by the surgeon. That's a complication. The other one is 𝗧𝗵𝘁. 𝗧𝗵𝘁 formation, meaning after surgery, your body reacts to the healing process and it starts forming a lot of clear fluid that accumulates under the skin and causing the bulging. And the surgeon probably initially goes put a syringe in there and suck it out, or put a catheter or a drain back in to get the fluid out. Another term that you may hear is necrosis. Necrosis means the skin dies off after surgery, and that's depending how large the skin is elevated, or we'll call it flap, and lack of oxygen or delivery of blood to the tissue may cause this portion of the skin to die off. That's what we call necrosis or wound. Submandibular gland reduction. Well, submandibular glands are salivary glands or saliva producing glands that are located under your chin area. Also, we have parotid and lingual and other salivary tissues in the mouth that produce saliva. But the one that I'm talking about is here. When you put your head down, it bulges out. We reduce that during the deep plane neck lifting, and it's not we reduce all of it. I normally reduce half of it, the portion that is bulging out, like if a golf ball, I split it in half, and there's the half part that is hidden inside, and it still functions. So you don't end up having no saliva because you also have your parotid tissue and half of those submandibular glands which are inside. So it's a great procedure to create a very well-defined neckline. Ectropion. You may hear that when the surgeon talking about your lower eyelid surgery. So if the surgery is done by cutting the skin under the eyes and redraping the skin, removing the excess skin and put it together, sometimes the tissue scars and pulls the lid down, and the eyelid will look like this. That's called ectropion. And sometimes it's resolved initially if it is mild, but sometimes it requires surgical procedure to repair it.